I'm Dr. Christopher Crawford, and I'm a general and bariatric surgeon here in Carmel, Indiana. And today I wanted to talk a little bit about goal weights. A lot of people after they have bariatric surgery want to know what should they weigh, like what is their goal? And the answer is it depends. There's not exactly one way to figure out what somebody should weigh after bariatric surgery, but there are a couple different things to consider. We have something called an ideal body weight, and a lot of people look at that and think that's what their goal weight should be. So for a woman who's 5'4", the ideal body weight might be 120 to 130 pounds. For a man who's 5'10", that might be 160, 170 pounds. But that's very different from a goal weight for somebody who's undergoing bariatric surgery. Most people having bariatric surgery are 100 plus pounds overweight, and what we do is we calculate what their excess weight is. If someone's 100 pounds overweight, that's their excess weight, and the way that we determine how much of it they're going to lose after bariatric surgery is based on which procedure they have. If you have a gastric sleeve, most people would lose 50 to 60% of their extra weight. Gastric bypass, maybe 60-70% of their extra weight. Duodenal switch, maybe 70 to 80% of their weight, and that's how you will determine what somebody's weight is going to be. So when somebody has one of these procedures done, they will lose, say, that percentage of weight. So if someone has a gastric bypass and they're 100 pounds overweight, they would lose 60-70 pounds. If their ideal body weight were 140 pounds, they would go perhaps from 240 down to, 170, 180, something like that, and that's what we would expect them to be able to maintain. So it's not their ideal body weight, but that's not necessarily important. The goal is that their health conditions improve, their mobility improves, and they're able to do more things that are important to them. So getting to an ideal body weight is not necessarily the goal. However, some people do set that as their goal, and as long as they can achieve it safely, then that's fine too. But just know that most people aren't able to go from where they started all the way down to an ideal body weight, usually from bariatric surgery. Another important thing to remember is that most people will hit a low point on their weight loss and then have a little bit of a regain as their body sort of stabilizes. Your body has a lot of different mechanisms that all contribute together to what we call homeostasis, which allows for a steady state. And your body doesn't like to do this with its weight, so it will come down to a low point and then try to balance itself. And for most people, that might be about a 10% regain from their lowest point. So a lot of people will come to me right around the stage when they're at usually their lowest weight, which tends to be 12 to 18 months after bariatric surgery, and they'll say, I've lost too much weight, or how do I stop myself from losing weight? And the answer is, usually don't try to specifically do that. You want to make sure you're eating healthy food choices and having healthy portion sizes, and make sure you're working with your bariatric team, the dietitian, your surgeon, and make sure they know what's going on. But usually don't try to stop your weight loss any sooner than your body is going to let you. You want to let it go as far as it's going to go, as long as you're doing healthy things, and know that a little bit of regain is likely, maybe 10% of your weight, and as long as you don't pick up bad habits, then that's usually where somebody will be able to stay in the long term, and we're talking years and potentially decades. If you pick up bad habits, you can see weight regain, but most people can then maintain in that range. So you can calculate what is your expected results based on, figure out what your ideal body weight is, what your current weight is, what the difference is in between those two, that's your excess body weight, multiply it by that percentage that you're expected to lose from the procedure that you pick, and that's roughly what a reasonable goal weight would be. If you want to lose more, you're going to probably have to try harder. And if that seems like too much, maybe don't necessarily try to stop yourself too soon, because you may end up landing at that weight even without any additional interventions. So hope this was helpful.